Both organizations, in collaboration with the Hanley Center for Health, Leadership, and Education, are so pleased to welcome you to our webinar series, Healthy Energy, Healthy Homes, Healthy Maine, Connecting Climate Solutions to Better Health in Maine. This first webinar, Fossil Fuels and Health, the Medical Case for Electrification, is presented by our colleagues at Greater Boston PSR, and we are so delighted to welcome Dr. Susan Racine, a semi-retired general internist with 32 years of experience in primary care and co-chair of the Greater Boston Physicians for Social Responsibility Board of Directors, and Andee Krasner, a public health consultant and volunteer with Greater Boston PSR, whose research and advocacy focus on the intersection of energy, policy, air quality, public health, and the built environment. Toward the end of today's session, we'll share a link for you to complete a short evaluation. Health professionals seeking continuing medical education credit will also find instructions there. Please take a moment to complete the evaluation right away, and don't forget to sign up for the remaining webinars in the series. And now I will turn it over to Susan and Andee. I think
Susan, you're on mute. No worries. We
Good
all
morning.
do it.
Sorry about that. And I'm seeing some familiar faces. Thank you all for having me and having Andee. And if we could start my slides, please. Perfect. So I'm happy to be joining my colleague Andee Krasner to talk about the health benefits of electrification in buildings, because Andee guided me through the process of switching to an air source heat pump and an induction stove, and I am very indebted to her. This first slide shows an all-electric home, the ideal standard of healthy living. It's got clean energy produced by solar panels, electric heat pumps for space and water heating, an induction stove, and an EV and e-bike in the garage. I'm not there yet, but we're on the road, and we do have the electric lawnmower. This all-electric home is the ideal, but in reality, most people burn fossil fuels in their homes either for heating or cooking. Some homes use wood, but we're going to see that burning wood, just like burning fossil fuels, causes air pollution. Today, I'm going to talk about the specific air pollutants that are emitted when we burn used fuels in buildings and how they affect health. Next slide, please. But first, I want to highlight the big picture, that burning fossil fuels in buildings contributes to climate change, the largest threat to human health. The most powerful hurricane in Jamaica's history made landfall yesterday, powered by our warming climate. And we see some pictures of Katrina. We should have learned by now. Next slide, please. I also want to mention that natural gas doesn't need to be combusted to cause global warming and air pollution. Natural gas is methane, and it's produced by fracking. And fracked gas leaks at every step of its production and distribution. And it's a potent greenhouse gas, 86 times more potent than carbon dioxide in warming over 20 years. And on the left side of this slide is a depiction of the large volumes of gas escaping the aging gas pipeline infrastructure in Boston in a 2016 study, with the yellow peaks having the highest concentrations of methane. And on the right side is a map of all the gas leaks in eastern Massachusetts in 2024. So you can see that there's lots of gas leaks at the gas distribution level, but in a matter of fact, the largest volume of methane is leaked at the fracking wells. There are also leaks in our homes, unfortunately. Fracked gas is wasteful, it's warming the planet, and it's not good for us. Next slide, please. This is a slide from a pipeline application for a permit, and it shows that fracked gas does not travel alone. In the little red box, you can see that there's benzene present in the gas. And benzene is classified as a group A carcinogen by the EPA. That's the highest level that there is. They are certain that it causes cancer. There's no safe level. And there's also above it, there's a little box that says HAP for hazardous air pollutants. So there's plenty of those in this gas as well. And when gas leaks, these are in its company. So now that I've touched on air pollution produced by fossil fuels before they are even in use, we can discuss the products of combustion. Next slide, please. So this cartoon shows clouds of different air pollutants that are emitted when fossil fuels are burned in the home. Most of the emissions are vented outside to the surrounding air, but some remain indoors. We can see that the appliances that are producing these clouds include the furnace and the water heater in the basement and the gas stove on the first floor. We could also add a clothes dryer to this mix. Next slide, please. And in those clouds were lots of letters and numbers. So air pollution is like alphabet soup. There are a host of chemicals produced from the combustion of fossil fuels in buildings, including the following criteria air pollutants, and we're going to go from left to right. We have ozone, carbon monoxide, nitrogen dioxide, and I'll also be talking about NOx, which is nitrogen oxides, has the same adverse effects. Sulfur dioxide, and fine particulate matter called PM 2.5. And it's so called because the particles are 2.5 microns in diameter. There are other particulate matter air pollutants, specifically PM 10, but PM 2.5 is the most dangerous, so we're going to focus on that. So criteria air pollutants are levels are regulated by the EPA, at least for now, under the Clean Air Act. They're widespread and they're hazardous to health. The last little circle, VOC, stands for volatile organic compounds. Now, these are any of the thousands of organic chemicals that are present at a gas as gases at room temperature. VOCs are not regulated as criteria air pollutants, but they are one of the sources for ozone on the other side of the little group of circles. Many VOCs fall into the category of hazardous air pollutants, and hazardous air pollutants are known to cause cancer or other serious illness, but the EPA doesn't regulate their concentration in ambient air. Instead, the EPA works with industry to try to reduce the amount of these emitted. Next slide, please. The American Lung Association published a study on the impacts of residential combustion in the US in 2020. And this table is from their paper, and it's sourced from data from the EPA from 2017. So along the top, you can see all the different air pollutants, and along the left-hand side, you can see the fuels that are being burned and are the source of these different air pollutants. The second row from the bottom shows total air pollutants from residential combustion, and that's compared to the very bottom row, which is all sources of air pollutants in the US. Surprisingly to me, wood produces the largest amount of every air pollutant except for nitrogen oxides. Wood seems to be so natural, but clearly inhaling wood smoke is a bad idea. Although most homes don't use wood for fuel, it is more often used in rural areas, and that might include Maine. And this data also highlights how awful wildfires are for air quality. But as you can see in the top row, natural gas has the highest nitrogen dioxide emissions of all the nitrogen oxides emissions of all the fuels. Next slide, please. Nitrogen dioxide is very irritating to the airways. Oh, whoops, sorry, I'm jumping ahead. It forms from the reaction of nitrogen and oxygen in the presence of heat. Natural gas burns a lot hotter than oil or wood and thereby creates more nitrogen dioxide emissions. Other sources of nitrogen oxides in the atmosphere include cigarette smoke and auto emissions. Combustion basically causes nitrogen oxides. Next slide, please. So nitrogen oxide is very nitrogen oxides are very irritating to the airways. Inhaling it causes asthma attacks and aggravation of lung disease. This is according to the EPA. The EPA has also determined that it likely is a cause of asthma, and it may increase susceptibility to respiratory infections. The EPA also reports that results from studies suggest that short-term exposure may be associated with cardiovascular effects and premature mortality, and long-term exposure may be associated with cardiovascular effects, diabetes, poor birth outcomes, premature mortality, and cancer. However, these adverse health outcomes may not be independent of other air pollutants when fuels are burned. But in 2021, based on the accumulation of research evidence, the World Health Organization decreased their recommended average annual safe threshold of nitrogen dioxide to only 5 parts per billion from their previous level of 21 parts per billion. Now, the EPA's safe limit is 53 parts per billion, but the World Health Organization and the EPA do agree on the 1-hour exposure limit of 100 parts per billion. Next slide. And as I became familiar with the problems of air pollution through PSR, I began to see some relevance in my practice. For instance, there's this case of the new cough. At an appointment in the winter months in the early 2020s, I saw a 36-year-old female with a several-week history of a new onset dry cough, some chest tightness, and she got short of breath with running, but she didn't notice any wheezing. She had no symptoms of a cold or a flu, but she had tested for COVID and it was negative. It wasn't in her electronic medical record, but during the appointment, I found out that she had a history of childhood asthma, but it had been inactive for decades. She never smoked. She didn't have any history of allergies. She had no work exposures. She was working at home because of COVID, and she had not adopted any new pets, and she didn't have any old pets, and she was on no meds. So basically pretty healthy. Turns out she lived with her boyfriend in a 1-bedroom apartment, and they were really enjoying doing lots of cooking together. And when I inquired further, it turns out she had an unvented gas stove where she was doing all this cooking. Her physical exam was pretty unrevealing, but she wasn't having symptoms at the moment. So this was probably a reactivation of asthma due to exposure from nitrogen dioxide from cooking in a small place with an unvented gas stove. So I treated her for asthma, but we also discussed the potential exposure to the air pollution, and she started opening the windows when she was cooking, and she got better and did well. Next slide, please. Another pollutant that we hear about a lot during the winter is carbon monoxide. According to the CDC, carbon monoxide poisoning is responsible for more than 400 unintentional deaths annually in the US, and that doesn't include fires. It's responsible for 100,000 ER visits and 14,000 hospitalizations. Carbon monoxide is a colorless, odorless gas emitted when there is incomplete combustion of a fuel, usually because of poorly functioning equipment or poor ventilation or an inadequate supply of oxygen. And carbon monoxide has its toxic effect because it preferentially binds to hemoglobin and displaces the oxygen. And this leads to symptoms of hypoxia in the end organs. Typical symptoms of carbon monoxide poisoning are headache, dizziness, weakness, upset stomach, vomiting, chest pain, and confusion. And of course, at high levels, it can cause death. Concentrations outdoors are usually low, but concentrations can be high indoors, especially if there's a faulty furnace or an improperly vented fuel burning device. So carbon monoxide monitors are essential to detect high concentrations since there's no other odor or color to let you know you've got a problem. The diagnosis of carbon monoxide poisoning can be made by an elevated carboxyhemoglobin level, and venous samples are adequate in stable outpatients, but if you're in the emergency room and unstable, they would get a blood gas or possibly use a non-invasive pulse carbon monoxide oximeter. A carboxyhemoglobin level of greater than 3% is elevated in non-smokers or greater than 10% in smokers, because cigarettes cause carbon monoxide, cause the inhalation of carbon monoxide. Next slide, please. So one of my patients, on her way out the door at the end of the appointment, wanted to mention her new onset headaches. She was a 45-year-old female with she had no history of headaches, no history of migraines. And in the last week, she started having daily headaches at both temples. And she mentioned having increased stress at work, but she was always having stress at work. So that was not really a new variable. And who isn't having more stress at work? Anyway, she had no visual symptoms, no associated nausea and vomiting, no recent cold or flu. She wasn't on any new medicines. On exam, there was no sinus tenderness. She had a normal neurologic exam. There was no abnormalities on her fundoscopic exam. And so we attributed the headache to her work stress, but I wasn't very comfortable with that. So I asked her to promise to call me if her symptoms didn't improve. And yet she never called. But fortunately, neither did the emergency room. So when I saw her on a follow-up appointment, I said, what happened with your headache? And she said, oh, I got a new plumber. She said, the old one messed up the way my furnace was venting, and I was breathing in lots of carbon monoxide. And so I was grateful that she hadn't died. And I realized that a carboxyhemoglobin level would have been appropriate at that appointment with the new onset headache. But it also would have been important for her to have a carbon monoxide monitor in her home. Next slide. And this is just to tell you that carbon monoxide also can have harmful effects at lower levels than the carbon monoxide monitors will alert you to. As you can see, healthy people will get headaches at levels as high as 200 parts per million. But a carbon monoxide monitor will alert you before that, because they tend to go off after about 10 hours of 40 parts per million. However, as you can see on this slide, for susceptible individuals, lower concentrations can have health effects. Levels below 40 can cause angina in patients with heart disease, and some studies have shown worsening asthma or worsening congestive heart failure or adverse pregnancy outcomes at exposure to levels below 40. So for patients with cardiac disease, we might recommend that they buy one of those ultra-sensitive carbon monoxide monitors that will give you a digital readout for levels as low as 10 parts per million and will sound an alarm at 25 parts per million. And we should also consider checking carboxyhemoglobin levels in our patients with new onset headaches. And we should recommend that all persons using fossil fuel powered appliances in their home have a carbon monoxide monitor. Next slide. Moving on to another pollutant. PM 2.5 is another pollutant. This slide shows a cross-section of a human hair to demonstrate the size of 2.5 microns. So that big gray bar is a human hair. The blue dots are PM 10, and the little red dots that you can't see is PM 2.5. And these microscopic particles are not inert. They are composed of a mix of hazardous chemicals, carcinogens, heavy metals, and microorganisms. They cause inflammation in the airways in the lungs when they are inhaled, but they are so small that they pass readily through the alveoli into the bloodstream. And once in the circulation, they cause inflammation and harmful effects throughout the body. There is no safe level of exposure for PM 2.5. And in adults, they, in addition to the respiratory effects, they cause heart attacks, strokes, cardiac arrhythmias, lung cancer, and premature death. In pregnant women, they cause pregnancy complications like preterm birth. In children, they cause asthma and impaired lung development. And there's also growing evidence that PM 2.5 is damaging to the nervous system in children and adults, leading to some neurodevelopment disorders or dementia. Next slide. On the right, there's a graphic. On this slide, there's a graphic from the New England Journal of Medicine showing pollution's effects on the cardiovascular system. And hint, hint, this could be on the test. And on the left, there is information about how much of an increase in PM 2.5 can cause the cardiovascular effects we talked about, the sudden death, the cardiac arrhythmias. As little as an increase in 10 micrograms per cubic meter will increase your risk of the cardiovascular effects by 1 to 2%. Next slide. We're moving on to ground level ozone. This is different from the stratospheric ozone, which is protective for the Earth. Ground level ozone is a product of air pollution. Nitrogen oxides plus VOCs in the presence of heat and sunlight cause ozone to form. And that's why levels are so high during the hot summer days. Methane is one of the VOCs that can contribute to ground level ozone. And as we know, methane is leaking everywhere in the gas pipeline system. The EPA has determined that long-term exposure to ozone is linked to aggravation of asthma and is likely to be one of the many causes of asthma development. Persons with respiratory disease are at some of the highest risks from ozone, and children are at the greatest risk because their lungs are still developing. They're more likely to be active outdoors when ozone levels are high, and they're more likely than adults to have asthma already. Next slide, please. Sulfur dioxide is usually, most of the sulfur dioxide is from power plants and other industrial facilities, but burning wood or oil in residences or other buildings does produce sulfur dioxide. Short-term exposure to sulfur dioxide can harm the human respiratory system and make breathing difficult. It can cause asthma attacks like many of the others we've talked about. So people with asthma, particularly children, are sensitive to these effects. High concentrations leads to the formation of other sulfur oxides, which can react with other chemicals to be part of the PM 2.5 pollution. Next slide, please. And VOCs are emitted into indoor air from unvented combustion, such as smoking cigarettes, burning wood or kerosene, or cooking with gas stoves. Other sources actually include building materials and household products like new carpet. But many VOCs are hazardous air pollutants, and some of them are carcinogens like benzene and formaldehyde. Formaldehyde is a trigger for asthma, as so many of the others are, but it's also a cause of lung cancer and nasopharyngeal cancer. Benzene is known to mainly cause hematologic problems. It's known to cause acute myelogenous leukemia, and it seems to be linked to some of the, it may be linked to some of the childhood leukemias, but it's known to cause cytopenias, immune system deficiencies, and aplastic anemia. And like I said, some studies have started to see some in associations with childhood anemias and also childhood leukemias and multiple myeloma and non-Hodgkin lymphoma. However, the evidence isn't as strong for those cancers as it is for acute myelogenous leukemia. So at this point, I hope I've convinced you that burning fossil fuels in our buildings leads to air pollution and contributes to many different types of diseases as well as climate change. Oh, next slide, please. This just shows that the benzene, and just like particle pollution, there is no safe level of exposure, and so any benzene is bad for us, and none is neutral. And next slide, please. So now that we know that air pollution is not good for us and that it is caused by burning fossil fuels, I want to just mention the American Heart Association recommendations for clinicians. They recommend obtaining a brief history of pollution exposure when it's relevant, like the new cough. They recommend assessing individual susceptibility, like people with pre-existing lung disease or cardiovascular disease, and providing guidance on pollution mitigation and avoidance, like not exercising on hot summer days when the air quality is bad, or when not opening the windows when there's wildfires, etc. And I will now hand it over to Andee to talk more about the impact of fossil fuel combustion and the special concerns regarding gas stoves. Thank you.
Thank you, Dr. Racine. My name is Andee Krasner, and I am a public health consultant. I'm really excited to have the opportunity to talk with you today about why all electric buildings are healthier and safer than homes heated by fossil fuels. Next slide. There are three main reasons why all electric buildings are the healthy choice. They emit less climate pollution. They are safer, there's no risk of explosion, and they improve indoor and outdoor air quality at the point of use. Next slide. So let's start with climate pollution and building safety. Next slide. Together, residential buildings and commercial buildings emit about 1/3 of Maine's greenhouse gases, and that does not include electric power. So that's the pollution stems from using fossil fuels for heating and cooking, and that currently 80% of Maine homes actually use fossil fuels for heating, mostly with oil. So should Maine buildings transition to heat pumps and electric stoves powered by clean energy, Maine could significantly reduce its emissions, which would help mitigate climate change. Next slide. This is a complicated slide, and it shows a lot of the health impacts of climate change. I just want to point out that building climate pollution does contribute to climate change, which we know is one of the most significant public health threats in our lifetime. I just want to point out a couple of health impacts that you're likely to see in your practices as a result of the changing climate. You're more likely to see respiratory illnesses because there's more allergens, a lot more hot days, and more air pollution. And milder winters are contributing to an increase in vector-borne illnesses like Lyme disease. In Maine, Lyme disease cases rose from just 20 cases in 2020 to over 200 cases in 2024. Next slide. So using piped gas or propane on site assumes a certain level of risk of explosion. In this picture, a leaky propane line caused a deadly explosion in Farmington, Maine in 2019. And just a year earlier, a gas pressurization mistake caused fires and explosions in 40 homes in Merrimack Valley in Massachusetts, where I live, and caused a death. All electric buildings don't have this risk of explosion, so it's a benefit to them. Next slide. So now we're going to switch gears and talk more in depth about outdoor air pollution. When people think about air pollution in their communities, they tend to think of industrial sites like this paper mill in Rumford or power plants. Next slide. Fewer people think about the air pollution that is vented from heating appliances like furnaces and water heaters, but thousands of buildings are burning gas, wood, or oil for heating, and they're contributing to air pollution. Next slide. For example, in Maine, nitrogen oxide concentrations from buildings are actually 14 times higher than power plants. This is because power plants are required to use scrubbers and minimize their pollution, while buildings are not. They vent all of the pollution directly into our neighborhoods. Next slide. I have to say, Maine has some of the best outdoor air quality in the country, with only a few counties receiving C's and none receiving D's or F's. But you can see that Cumberland County, where Portland is, has one of the lowest grades. Next slide. So despite a really good record on outdoor air quality, even at low levels of air pollution, it's still impacting the health of Mainers. So a study of Harvard Chan School of Public Health estimated that air pollution from burning fossil fuels in buildings, so this is just in Maine, and this is just from burning fossil fuels in buildings. It is estimated to cost about $1 billion in health impact costs every year. And that's likely an underestimate because they don't include chronic illnesses like asthma or heart disease. Next slide. So replacing fossil fuel space and water heating with heat pumps actually have a lot of benefits. The first thing is that they provide very efficient heating, so they cost households less money to heat than oil and electric resistant heating, and it's getting close to gas. They provide very efficient cooling in our warming summers. There's no risk of explosion. And then most of the building emissions are from space and water heating. So using a heat pump can significantly reduce climate emissions and air pollution. And the good news is that Maine's actually doing the right thing. It's been leading the country in installing heat pumps with a goal to install 275,000 cold climate heat pumps by 2027, and they've already installed over 100,000. Next slide. While Maine has really good outdoor air quality compared to a lot of areas around the country, that actually may not be true for indoor air. Next slide. The EPA states that indoor air is often 2 to 5 times worse than outdoor air. And the reason for clinicians to pay attention to this is because people spend most of their time indoors, whether it's at work, school, or at home. So the quality of indoor air is actually quite important. Next slide. As Dr. Racine mentioned, there's a lot of contributors to poor indoor air, including incense and candles, VOCs from carpets and furniture. If somebody's smoking, that degrades air quality. But one of the overlooked sources is a gas stove. And having a gas stove is just as bad as having a smoker in the house. So gas cooking emits nitrogen oxides, carbon monoxides, and VOCs like benzene. And interestingly, it's the only appliance that is not required to be vented outdoors by building code. Next slide. So homes with gas stoves have 50 to 400% higher nitrogen dioxide concentrations than electric homes. And you can see here on the right, the graph shows that when the cooking equipment, whether it's a gas oven or a gas burner, is turned on, the red line, which represents nitrogen dioxide concentrations, quickly jumps up above the 100, and the 100's that middle line. And that 100 represents the EPA 1 hour health standard of 100 parts per billion. So when you're cooking with gas appliances, it can exceed EPA outdoor health standards. Next slide. So we want to know if the concentrations that are in the home are actually affecting individual exposure. So this was an individual exposure study that evaluated exposures from indoor nitrogen dioxide and outdoor nitrogen dioxide. It found that children who lived in homes with gas stoves were exposed to the most nitrogen dioxide indoors, and that the primary source of that nitrogen dioxide was the gas stove. Next slide. Gas stoves also emit low levels of carbon monoxide, whether they are properly adjusted or not. And the carbon monoxide concentrations can actually exceed the EPA 8-hour health standard of 9 parts per million. Note that this is a lot lower than the 200 parts per million where people start to get headaches, right? That Dr. Racine talked about. So the EPA suggests that that health standards for carbon monoxide concentrations are actually quite low. You'll see that background levels in all electric homes with the electric, not all electric homes, but with electric stoves, just have an average of 0.5 to 5 parts per million of carbon monoxide. But homes with properly adjusted or poorly adjusted gas stoves have much higher concentrations. And I don't know about you, but I had a gas stove for 10 years and I never adjusted it. So I don't know if it was properly or poorly adjusted or a combination of the two. Next slide. So gas stoves also emit benzene, so much so that in this study, the concentrations in kitchens and the bedrooms were found to exceed California health standards for benzene in a small proportion of the houses tested. Disturbingly, the benzene actually continues to leak from stoves even when they're turned off. And this was true for new and old stoves alike. Remember, Dr. Racine mentioned that the WHO states that there's no safe exposure level. So if there's a gas stove in the home, people are being exposed to benzene. Next slide. Lower income households actually have a higher risk of being exposed to higher concentrations of gas stove pollution. They are more likely to use a gas stove for supplemental heat. And when I say a gas stove, I mean a natural gas stove or a propane stove. They have similar pollutants. And they're more likely to live in multifamily units and smaller units, which have been shown to accumulate higher concentrations of pollutions from gas stoves when there's a gas stove present. And they are likely to have inadequate ventilation. Many stoves across the US lack hoods that vent outdoors. The only estimate I've actually seen of how many homes actually have hoods that vent outdoors was from Lowell, Massachusetts, and they estimated that only about 50% of hoods vent outdoors. Next slide. So what do these frequent exposures mean for health impacts, right? Because you can be exposed to something but not actually have any increased risk for poor health outcomes. For many potential health impacts from gas stoves in the US, we actually have no or few studies for pregnancy outcomes, premature death, learning outcomes, dementia, and leukemia, just to name a few. So we're kind of blind when it comes to those. But we have some really good evidence for how a gas stove use affects pediatric asthma exacerbations, and adult hospitalizations. Next slide. So as we discussed, gas stoves emit really high levels of nitrogen dioxide, and the EPA, just as a reminder, assessed nitrogen dioxide and found it to be likely causal of asthma. So when we look at the presence of gas stoves, which emit high levels of nitrogen dioxide, it's not surprising that we find that children who live in homes with gas stoves have an increased risk of pediatric asthma. This was a meta-analysis, and it's found that in the presence of a gas stove, there was an increased risk of pediatric asthma, that the risk increased by 42%, and lifetime asthma increased by 24%. Next slide. This is a prospective study of more than 1,300 children with asthma. So these children already have asthma. And this was done by Yale University in Connecticut and Massachusetts. And what they found was that there's a dose response between nitrogen dioxide concentrations from gas stoves and risk of severe asthma. This is also consistent with EPA findings that nitrogen dioxide is causal of asthma exacerbations. Next slide. At a population level, we know that about 1/3 of households across the United States use a gas stove, and it's estimated that they cause about 10% of childhood asthma cases across the US, which is 50 to 200,000 pediatric asthma cases every year, with an estimated societal cost of $1 billion annually. And I am sorry, I don't have Maine-specific data on this estimate. Next slide. One piece of important information for epidemiologists in investigating causality is if an exposure is removed, is there a reduction in disease burden? And we find that's true for gas stoves. In Ecuador, they have this national program where they replace gas stoves with induction stoves. And between 2015 and 2021, actually 1/10 of Ecuadorian households installed induction stoves. And when they assessed the program, research researchers estimated that for a location with just 1% of households enrolled in the program, so an additional 1% of households, hospitalization rates for both all-cause illness and respiratory illness fell by 1%, and for COPD, it fell by 2%. Next slide. So we have really good evidence that the exposure to pollution from gas stoves can increase the risk of respiratory illnesses like asthma in children and adult hospitalizations. So how can we mitigate that exposure? There's several low-cost ways to reduce air pollution concentrations from gas stoves. The very first thing you can do is just turn on that over-the-stove hood. However, if it doesn't vent outdoors, which many don't, mine doesn't at my house, it will just recirculate the air in the kitchen and not exhaust any pollutants. And the other thing about the stove hood is that many people don't like to use hoods because they're loud. So it's important to encourage people to use them if they have them. If there's other ventilation in the kitchen, that can be used. And if there's no mechanical ventilation available, people can use an open window. Obviously, this is not possible if it's very hot or very cold outside, and it's not recommended if there are fires in the area. Another thing you can do is use the gas stove less. You can do that by using other electric appliances in the kitchen. And lastly, as Dr. Racine pointed out, it's really important to have a carbon monoxide monitor in place. It will not detect those unhealthy low levels of carbon monoxide, but it is important for detecting life-threatening levels. Next slide. Using the gas stove less can actually reduce nitrogen dioxide concentrations. So people can use a toaster oven, a microwave. They can consider buying these single induction burners. That's in the lower right-hand side. They cost about $75 to $100. My parents-in-law have this huge 6-burner gas stove, which they're not ready to part with, but they've purchased 2 of these single induction burners, and they cook on that instead to reduce the pollution in their kitchen. Next slide. I'm actually often asked about how well filtration works in comparison to stove hoods that vent outdoors. And there was this randomized control study that actually answers this question. So I have an answer for you. They compared the gas stove with an electric, replacing the gas stove with an electric stove to air filtration with a gas stove to a vented hood with a gas stove. And obviously removing the source of the pollution reduced nitrogen dioxide the most. So replacing the gas stove was the most effective, but filtration was also very effective. If filtration is used, it's important to make sure it's not just a HEPA filter which is for particulate matter, but that it has carbon filaments so it can catch those gases like nitrogen dioxide. And the vented hood did not work very well, and the authors surmised that it could be just because it's loud and people didn't turn it on. The filtration is a little quieter. Next slide. So the American Medical Association, the American Public Health Association, and the American Thoracic Society have all recognized the health risks of gas stoves that they pose to children. And there are also state medical societies, including the Mass Medical Society, that have recognized this link. Next slide. So there are a few pulmonologists, well-known pulmonologists, published clinical recommendations in the Annals of the American Thoracic Society about assessing gas stove pollution. They suggest adding a question about gas stoves to environmental exposure histories, counseling patients on the harms of gas stove exposure, especially for susceptible groups like children or people with asthma. And they recommend specific interventions based on available patient resources and circumstances. So hopefully you have some ideas, some low-cost ideas for how to reduce pollution in the kitchen. Next slide. So we talked today about all electric buildings and why they're the healthy choice. They emit a lot less climate pollution. There's no risk of explosion, and they improve our indoor and outdoor air quality. Next slide. So thank you for your attention today. I look forward to answering your questions. I've put a couple of additional resources in the slides for you as well.
Well, thank you so much, Susan and Andee, for these enlightening but disturbing results of studies and recommendations for clinicians. We do have time for some questions. And I think, let's see, I can't see everybody. So if somebody can see everybody, then if you would like to raise your hand electronically, if you have any questions. Otherwise, I have a couple questions. Steve Shannon.
Yes, hi. Thank you very much for this presentation. As I deal with people who are committed to cooking with gas stoves, or who who live in Maine and are used to having wood stoves, etc., there's a great amount of opposition to changing the way things have been, and of course the denial these days of science related to it's good for you. I mean, they won't take vaccines, are they? Why would they change their stuff anyway? Do you have any suggestions on how to educate the public and get to the point where you can actually have policies that could affect these things? Either.
Andee?
Yeah, you ask a really difficult question. I mean, if somebody's in denial of the science, it's really hard. When I talk to friends, I have friends who love their gas stoves. I really just focus on their own experience with it. A lot of times they'll say, well, I have a constant cough when I cook, or they've got a runny nose. There's a lot of respiratory symptoms that people have when they're cooking with a gas stove. I just basically focus on those, as saying, like, you could actually improve your experience by opening a window or using ventilation. I, as far as policies go in Maine, I mean, Maine has actually been leading the country with some of its policies on building electrification. So despite maybe a few people's denial of some science, you guys are moving ahead from a policy point of view. And you can point out that indoor air quality is improving, outdoor air quality is improving. It's immediate effects, not just climate change, which people really don't feel in their normal lives. So I think focusing on health and really making it tangible to people in their daily lives is what has been helpful for me personally.
Great.
In my own household, I have a husband who does all the cooking and loved his gas stove. So he had to sit through this presentation multiple times before he finally agreed to go for the induction stove.
Great.
And
Thank you.
there is a bill in Massachusetts right now for a warning label on gas stoves in appliance stores, where who knows if it'll pass. It did pass in Colorado.
Great, thank you. Are there other questions? If not, I had a few. If we have time, looks like we do. A lot of people in Maine use propane to cook with because their quote natural gas isn't available. And I know that propane is probably a little bit less polluting, but how much less polluting is it? And is that a reasonable way to reduce exposure?
Actually, there's a study that looks at the emissions from gas stoves and propane, and they have similar emissions. So the, propane is actually not healthier. They're equally bad, natural gas and propane.
Yes, indeed. Jen from Northern Light.
Hi, thanks. I think, you know, propane is really popular in Maine for one of the reasons is because, you know, historically we've had, and probably not just historically, had like prolonged power outages, and you know, it's nice to have a stove that works during a power outage. But also I think other appliances too. And I just was wondering if you could talk a little bit about beyond stoves. Like in my own house, I have a propane hot water heater. I know people who have propane clothes dryers. And so I think that those are probably better because they're better vented automatically outside. But now I'm not sure. And I was just wondering if you had any information about that.
So whether it's propane or natural gas, if it's an appliance like a water heater or a furnace or a dryer, they all by code are supposed to be vented outdoors. So yes, that air pollution is not going directly into your house, but it is going directly into your neighborhood and can impact you there. There's the same amount of particulate matter that we saw, that like just an increase in particulate matter by 10 micrograms per cubic meter increases people's risk of death by 1%. That's a very small jump. So if everybody's using propane, that contributes to that jump. So there is a health impact to it. I get that it's nice for backup fuel, and certainly it's nice to have that, but most of the appliances require electricity to work. So like even your water heater, usually it's propane and electricity, or the furnace is the same way. So you can get around that. I get that on a gas stove, and we have, but it's not like you're going to be heating your home if you have a propane furnace. So it's fine, I think, to use as a backup fuel if you want to use it for a generator or something like that as backup on the day when you have the electricity out. But as a fuel that you use every day, it's just as polluting as natural gas.
Thank you, Andee. We are 2 minutes from time. So unless there are other questions, I think we will thank everyone for being here. Thank our great speakers for doing this and for educating us. And policy ultimately is going to be what we need. And it's not always clear what policy changes are going to be most effective, but certainly that's what our group, the Alliance, is working on. So thank you all for being here, and let's keep working to try to improve the health of Mainers and the health of the planet by finding policy and individual solutions to this terrible problem. Thank you.
And please, when you close out, you will get a link for an evaluation. Please complete the evaluation so that we can continue to improve these. Also, if you want CME, you need to do the evaluation. So thank you very much.